Hello, I'm Natika Halil, Director of Health and Wellbeing from the Family Planning Association. It can be difficult talking to anybody about sexual health, regardless of their age, but older people might be harder to talk to because you may have made assumptions in your head or you don't want to approach that subject with them. However, what we know about older people is that STIs are on the rise, and therefore we need to address such issues with them. We can't think that sexual health or sex is the preserve of the young. We're also thinking about a generation, a baby boom generation, where the pill was available and the main thing was preventing pregnancy, so preventing STIs wasn't in the mindset at that time. So this is the generation who have missed the messages about sexual health, and therefore we need to kind of look at how we can readdress the balance, if you like. It's not just about younger people. Older people have sex as well. And therefore, if they have sex, they need to hear the sexual health messages. And this may be learning how to use condoms again, or learning how to use them effectively, for example. So I would suggest not to be embarrassed about talking to older people. The main thing about pharmacists is that they're going to be accessible. They're there to talk to somebody about sexual health matters, but you need to let your customers know that you're available to them to talk about it. If you don't let them know that you're available, then they're not going to come and talk to you. And the way that you can let them know you're available is having a simple poster in your pharmacy which says, we have a private room to discuss your medication, to discuss any matters with you. And if somebody comes up to you and starts talking about their medication, for example, you can gently pull them over and manoeuvre them into a private room to have a discussion without embarrassing them, without breaking their confidentiality or any of those things. And that's just a matter of kind of working on enhancing your own communication skills. And I think working on that will then lessen embarrassment as well with talking to older people.